Welcome, friends and followers. This is Nurses Talking. I am Dale Barzy. As always, if you like what you see and hear, give us a like, subscribe, leave us a comment. Let us know what you think. So today, my guest is Ms. Ann Marie Cowper, owner and CEO of Health by Ann Marie. Ann Marie is a registered nurse and a holistic health coach, and she has been a nurse for over 30 years and has experience in community health systems and major medical centers, including specializations in critical care, trauma, neurosurgery, neurology, pulmonary, and medical intensive care. When she left the realm of traditional healthcare, she worked in such areas as case management and initiatives in new healthcare reform, working to reduce costs and to guide patients. She gained experience with multiple organizations, providing counsel to several patient categories, ranging from elderly patients requiring short-term rehabilitation to long-term counseling for low-income immigrant communities first encountering the US healthcare system. Ann Marie has experience developing long-term relationships for patients to understand their alternative healthcare options. Her mission is to guide clients through every step of their healthcare journey with advocacy and encouragement. And she works with women to care for themselves while they care for their family and friends using conventional medical experience and alternative modalities. Welcome, Ann Marie.
Thank you so much, Dale. This is wonderful work that you're doing here. And thank you for inviting me.
Thank you. I really appreciate your time. So I'm happy that you joined us today. So the first thing I really always want to know from people is, why are they nurses? So who or what inspired you to be a nurse?
I think it was meant to be honest with you. When I was in high school, my mom was a nurse. And there are two things. My mom was a nurse, and I went into the ICU because I used to wait for her outside. She always worked over the time she was supposed to, as so many of us do.
Mm-hmm.
And I peeked in the door, and it was the intensive care. And I was, to be honest, fascinated with the machines.
Yes.
So that is really what got me into nursing. The other thing is I'm turning 60 years old, and back then a lot of women didn't know they had so many options.
Yes.
So my sister's a teacher and I'm a nurse, and I definitely wasn't going to be a teacher, although I am one now. That's how I started.
You know, it's amazing to me as I speak to people. I find that a lot of nurses actually have either family or friends who were teachers or who wanted to be teachers themselves and said, oh no, and then end up actually being teachers. I think we didn't realize when we got into the nursing thing that teaching is what we were going to do.
Absolutely. When I first had my private practice, I saw a nurse that I worked in the hospital with, and she said, Ann, where have you been? What are you doing? And I said, I started my own practice as a registered nurse. And she said, you can't work for yourself. And I said, yes, I can. I can teach. It's that simple and so important.
Yes, it is. Yes, it is. Yes, it is. So I know that nursing can be very challenging. So tell me, what are some of the challenges you encountered?
The first challenge was probably my own self-growth and confidence. When we first start out as nurses, you know, it's very intimidating, especially if you walk into a med-surg floor or something like that. Yeah. And or pediatrics, or there's so many. But just overcoming your, did I do that right? Why are they yelling at me? What do I do next? You know, it's okay not to know. Mm-hmm. And in fact, last year I participated in the American Nurses Association mentoring program, which is something that might be interesting for people to know about as a mentor or a mentee. Okay. The first year in 2016, they had 150 mentors, and now they have over 1,500.
Wow.
Yes.
Wow, that's good to know.
So that helps. Yes, it's great. It's a great resource. Mm-hmm. The biggest challenge, I would say, is communication, though, in healthcare in general. Mm-hmm, mm-hmm. communication among all the healthcare providers.
So, as you mentioned communication, then do you think that we're all, as we run around, because you know what we do, we move around very, very quickly. Do you think time or lack of time has anything to do with the breakdown in communication? That we just say things.
Yeah, now that you mention that,
Mhm.
it is now that you mention that, it's interesting because we come from all that, the different healthcare providers come from their own places,
Yeah.
even like physical places, and they
Yeah.
come in and we don't sit presently and come into each other's sort of
Yeah.
bubble,
Yeah. Yeah.
So that's the first step.
Yes. Exactly. Exactly. I would agree with that. So you've had, and I'm going to just jump ahead a little bit here because I see that you've had such a range of experiences, a wide range of experiences. You worked in so many different specialties, right? And then you pulled away from this traditional nursing model. What made you pull away?
Yeah, I loved intensive care, but something wasn't working. Something wasn't right.
Mhm.
And I had actually my sister-in-law, who works as a nursing professor at Yale, said, "Have you heard of the American Holistic Nurses Association?" Which
Right.
I'd never heard of it. And she's not a member of it, but she knew about it. And that set me on a path to recognize what's really going on with people. And to be honest with you, when I work with individuals, it's always about relationship, or at least that's the way maybe I come at it, but it helps people.
Mm-hmm.
So connection with each other, connection with an individual, connection with a family member, connection with work, whatever it is.
Mm-hmm. I see.
Yeah, but yeah. So that's really why. And when I left intensive care, I would always say, "Oh, I want to go back to that," because the drama of that is so exciting.
Yes, and the
But I knew
energy.
it wasn't where I was. And the energy,
Yeah.
exactly. And I
Mm-hmm.
love being around people. So,
Mm-hmm.
but I kept telling myself, no, that's not where you're supposed to be anymore.
Mm-hmm. 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 And so you moved into
Yeah.
Health by Ann Marie, and so tell me, what is this goal? What do you see? What is your vision for Health by Ann Marie?
Yeah. So my goal is for individuals to recognize that they have the power to heal themselves. And with the guidance of a nurse, it can be other people. I mean, honestly, you find different people on your path to getting healthier or dealing with an illness, but nurses can see both sides of the fence. So they see the conventional medical, and they can see the holistic or the primary nursing side. There's different terms.
Mm-hmm. Mm-hmm.
So I really want people to understand, in medicine is so complicated, and it amazes me that people don't understand it, but it just shows that as nurses, we need to understand that we really know things.
Yes.
Like we really know a lot. We're intimate with patients and people, and we know a lot about medicine, and sometimes it's different specialties. But if we can tell them, hey, it's okay, and this is what's happening, and this is your option. But
Yeah.
as healthcare professionals, we do often feel frustrated because why aren't they doing what they're supposed to do? Why aren't they? Well, the truth is maybe they're not supposed to do that right now.
There you go.
I mean, the thing, right? The
Yeah.
thing is, everybody's going to die, but how are you going to get there?
Yeah.
How are you going to live your life?
Yes. Yes, indeed. Yes, indeed. When I first came across your information about you, and my first thought was when it said Health by Ann Marie, and my first thought was, yes, here is somebody whose whose mindset is more towards health and prevention, and rather than let's fix it after it happens, and
Right.
so and that of course drew me, because that's where my head is. Let's prevent it rather than fix it, right? And I noticed that you bring both sides of the healthcare thing together, the holistic thing, the conventional thing, all of that together, which for me is, it's an awesome thing because they're not mutually exclusive.
It is. They are not
Mutually exclusive. So this whole pandemic, how did this affect your practice?
I had a practice, and I started a holistic nursing chapter in Fredericksburg, Virginia, where I live. And then this was in, I don't know, 2009 or something. And then I will share that in 2010, I had a stroke, and it was a small stroke, but it was enough to push me over the edge. It took me a while to realize it because I was pretty stubborn and just kept going till I fell on my face. And I tell people this because nurses, especially experienced nurses, have challenges and they have a healing journey. So that was mine. So it took me a while to figure out how to communicate, how to remember things. And what I learned was everything I learned before was in my head. I didn't have to go study it, or like people would come to me and ask me a question, and I would say, oh, it's probably this, or I would tell them this, and it would come out just like that. And I thought, how did I know that? And I would go run to my books and look, and I was like, yeah, that's right.
That's what it is.
And, so what I realized was my intuition and my inner knowing and the information I had before was already there. It would just come up just like that, but I had to learn how to trust it. So that took till 2020 when I opened my practice. And of course, we know what happened after that. And really, I always wanted to be online, but it is for those who work online, if you're younger, it's easier. But when you're older, it's more challenging. So but we have we have the experience.
Yeah.
So it's really important to me to get online with younger people. I love working with younger people because they get it so quickly.
Indeed they do. Indeed.
Yeah.
So do you think that going forward, well, I have two questions actually related to this whole COVID thing. As healthcare professionals, do you think, and as someone who, in the community who has a platform, do you think that we are doing enough to adequately educate people as to how to deal with not just this pandemic, but other pandemics and other areas of transmission of infection and all this kind of thing? Because this is not the last pandemic we're going to have.
We know that, don't we? As nurses.
Yeah. So do you think that, I feel, my personal feeling is that we throw I see that a lot of information is being thrown around, but not all of it is very educational for the general public. What do you think?
I agree. But to be honest, people didn't want to hear this information before.
That's true too.
It's very hard to accept the fact that you can take care of yourself. But what I saw before this was most of our problems were inflammatory. Yeah. I mean, really, autoimmune diseases are increasing, and they give them a name, and it's like, all right, let's give that a name. But the truth is our personal journeys and stress cause inflammation.
Yeah.
So I'm sorry, I can't remember your exact question, but
I'll go ahead. We can come back to the question. Yeah.
I think it is a process. We're switching the health system, and we're switching it from the bottom up. So people are getting the information. I would say for the general public, you're getting what you need, take what you need and leave the rest. And at the end of the day, let the rest go. And eventually you'll figure out your own health if you have a motivation to. And we will change this process. We will change it. And by the way, I'm getting my nurse coaching certification, which is a new general certification, which allows nurses to be in this environment to help with this process. It's so exciting.
It is very exciting. It is very exciting. I see in my view, I see a lot of changes coming in the way we deliver care and all of that kind of thing. So I think it's very exciting.
Yeah. So people are afraid, and I get that, and they don't know, and I get that, but I usually tell people it's going to be okay. You are where you are right now. Just keep moving forward. Don't give
Yeah,
up.
yeah. I get that, and a lot of one of the reasons I think people are so afraid is that there's just so much information coming at them in so many different forms and so many different voices that it's hard. It's hard if you have not been in the business of trying to sort out this. You've traditionally left your healthcare up to your doctor or your nurse or whoever it is, and all of a sudden all of this information is coming at you. It's very difficult to know where to go. So I can
It's
see
very difficult. I can see why too. You're right. There's so much, and it's really, most of it's white noise.
Yeah,
But you don't know.
but you don't know exactly. But you don't know. A lot of it is white noise. Actually, that's a great way to put it. It's white noise.
Oh, I know.
Yes. So, I know that you in your practice, I see one of your big things is self-care. Yes.
Yes.
What do you do for
Yes.
self-care? First of all, how important would you say, because I think it's something to be stressed, how important would you say self-care is?
Self-care is everything. But what I'm seeing as self-care is take 20 minutes out and do your nails, or take 20 minutes out and do a meditation, which meditation's great. But what self-care really is a constant check on your journey. And I equate it with a river. So you're in a flowing river and this is your journey. And sometimes it takes a right-hand turn and you have no idea that's going to happen. And you have to deal with that. And sometimes it takes a left-hand turn, and then it straightens out again for a little while. And we need support in that. We need to help each other simply. We don't need to fix. As nurses, we don't need to fix. We just need to be present, give information where it's needed, and let them get the insight into what's going on with them, because that is self-care. So they're a little more complicated issues. I'm not saying taking 15 or 20 minutes out just for you isn't good, because 20 minutes of quiet is a perfect way to reset your body.
Yeah.
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 Yeah. But setting boundaries and watching your journey and learning, becoming more aware and getting insights is the process of self-care.
Yeah. Yeah. I have learned recently, one of the things that I honestly, I don't know if I should use the word learned, probably assimilated into my own thinking and body recently, is that saying no is also self-care.
Absolutely.
I think that I think that as a female, as a nurse, as as a mother, it's saying no is not part of our DNA, so to speak. It's something I actually have to learn.
We say no and then we just hold on tight and see what happens,
Yeah.
And when you're in the middle of a hospital system, in the middle of the floor, the day, and you say no and you think everything's going to fall apart, it's really, the patients come to the healthcare system to learn, not just to get healthy. So we need to allow them to hear no. It's just not working right now. I'm sorry. Or not even I'm sorry, and
that's just the fact of it.
It is.
That's just the fact of it. So what do you do for self-care?
So I do journaling and I do a lot of inner child work. I have a teacher, and whenever I'm stuck, I call her and we work on things. And I I recognize at the end of the day that I'm just doing the best I can.
Okay.
I do, yeah, that's what I do. I have slowed down a lot, because I can't do as much as I had to slow down. I mean, in COVID, we all had to slow down. We had to
Yeah.
jump off the hamster, except for
Yeah.
nurses in critical situations.
Yeah.
But
Yeah. Yeah. And you mentioned doing the best that you can, and you know what? The best that you can is good enough.
yes, absolutely. And a
Yeah.
good example for others too.
Yeah. Yeah. So
Yeah.
what would you say then is your greatest achievement? What are you most proud of as a nurse?
I'm well, I'm a mother of 3. I have the mother archetype anyway, and I'm really proud of my 3 kids and how they are taking on their part in the world.
Yes.
And I started making them aware of that at an early age. And when they would come to me with questions, I would give them some information, but then I'd say, you have to figure out what you want to do.
Mm-hmm. Mm-hmm.
So they're all doing different things. And watching them, and I love to see what young people are doing. And I'm talking about, I know they don't think they're young, but like the 20s and the early 30 somethings. They're just amazing. They're
Yes.
really going to change the world.
Yes.
And they need support. They need a lot of support right now, and I'm really proud of that.
Awesome. 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 So, what words of inspiration or encouragement would you give to someone who wants to be a nurse, always considering being a nurse?
Oh, yes. I would say, if you want to be a nurse, go for it, knowing that you'll have challenges, but you'll find your way. And you're not responsible for everybody when you get out there. If you want to be a nurse, but you love math, or you love technology, or you love management, or something else, you can be a nurse.
Mm-hmm. Yeah.
So I would say, don't do an 18-month crash course in being a registered nurse. Don't do that. I would say the best path, well, the easiest path would be to get a bachelor's of science in nursing.
Yeah.
But the best path for some people who don't have a lot of money is get your, I don't know if they still have LPN or ADN.
Yeah.
Okay. Get that, get a job, get experience, and go back, continue with work. Get your bachelor's, get your master, or I guess they have DNP now. You can get that. I like the master's or the nurse practitioner program, frankly, but that's just my opinion. But find your way and learn to the point of happiness, in your work.
That's a good phrase. Learn to the point of happiness. Huh. I like that. I actually very much like that. Learn to the point of happiness. Yeah. There's so much that not just I think the pandemic has accelerated the burnout rate in healthcare providers, not just nurses. And I wonder, where this is going to lead, because a lot of people are opting out who really would not have, were it not for all of this. And so is it going to lead us? It's going to lead us. There's already a shortage. But I'm thinking of the health of those nurses and doctors and providers who are saying, I just can't anymore. And how are we going to care for them?
Yes. I mean, I've done a lot of work with alternative people who aren't healthcare providers, but what I learned with my nurse coaching program at Advancing Nurse Coaching is what I used, because I needed something that wasn't memorizing because of the stroke issue. But what I found was the resilience paradigm is being taught in that program. Okay. And it's actually a research project facilitated by Keith Blevins. I'm not sure if I'm using the right words, but he actually created, along with his partner, the resilience paradigm. And now they're doing research on it. What they're finding is if you can understand this paradigm, you can lower your burnout rate. And they are teaching it in hospitals and to doctors and healthcare providers. And it is lowering burnout, because we start to see that we're not responsible for the way things are. We have our part, our personal part, and they have their personal part.
Yeah. And that I think is absolutely a good thing and absolutely necessary, because you mentioned that word, we start to see we're not responsible. And for some reason, we always feel like we're responsible, you know?
Right.
So it's a good
But what
thing.
happens is we take away people's ability to learn when we take over the responsibility of what they need to do.
Yeah, that's right.
You know, so doctors get frustrated. Why didn't they do what they're supposed to do? Well, maybe they're not supposed to do it. I don't know. It's okay. It's all right, doc. See your next patient. They'll come back next month. They have to learn, you know, patients have to learn too. We need to let them.
Yeah, that's the thing. We probably become a little bit of a control freaks, huh?
Well, yeah, because I think I wonder if the schooling education makes us feel that way, and the hospital systems.
I wonder. Perhaps. Or I'm not quite sure what it is, but we do tend to do that. We do tend to want to dictate and control and be responsible, and just do what I say, rather than understand why you need to do this, or understand why I'm telling you this.
Right. Or trying to see what their challenge is, because it might have nothing to do with what you're trying to get them to do.
Exactly. And that's something. So Ann Marie, is there anything that you would like to share that we haven't talked about?
What I'd like to share is I see a lot of positives coming out of the tragedies and the changes that we've had. And I know it's not, nothing's all happy and blissful. We're struggling, but through the struggle, I think things are going to be better. So I really will look at the news and information. And I suggest people only take small doses of that heavy negativity, because it brings you down. And to try to look at the more positive areas. If you're not used to that, just do it a little bit. But I see that I see nurses, and there's a lot of, in the background, a lot of nurses are making changes in the healthcare. I think it's going to happen with at the bottom, that's how it's going to change. So I'm looking forward to that. Yeah. So hang in there, nurses. Find a resource, find some help, support.
Yes, indeed. And if we can, as nurses, if we can reach out and just understand each other, because we know what each other's going through, it's huge, enormous help. So Ann Marie, thank you so very, very, very much for agreeing to speak with me today. I really, really do appreciate your time. I wish you so much success with Health by Ann Marie.
Thank you so much. It was so nice talking to you, Dale. You're a wonderful interviewer.
And you too. Thank you a lot.
All right. Okay. Take care.
All righty.
Bye. Okay.
Bye-bye.